Good afternoon, everybody. Welcome to this session late in the afternoon. So I do hope you still have a lot of energy to listen to our story here. So I'm happy that we are here at this booth of Dr. Empel Science Services, and we are proudly also presenting what EIT Digital is doing. So what is EIT Digital? It's basically the European Institute for Innovation and Technology. And we have different organizations, and one of them is EIT Digital. So our mission is that we want to drive the digitalization into Europe, because there is at this moment a big problem. I mean, if you look to what's happening in the future, and we cannot say what's happening there, of course, but we can forecast, is that there will be definitely a lot of jobs needing digital skilled people. And at this moment, only 53% of all employees are really digital skilled, which is quite a challenge. That's the reason why also the European Union decided to come up with different activities to stimulate this. So one of the elements of EIT Digital here is that we provide a large partnership ecosystem. So that's one of the 3 pillars of our organization. And today we want to showcase some of our scale-ups and startups and innovation activities we are promoting and also investing in. And that's the reason why after my few minutes I would like to present some of those activities. So that's within our partnership, large pan-European ecosystem. It's all about large parties but also smaller parties, SMEs, big companies like Philips or Siemens or Nokia are also included. But the other thing is about accelerating. So accelerating smaller companies, scale-ups, and also helping them to access to market and access to finance. So that means that we provide them also the relations with venture capitalists, with financial institutions to further accelerate using finance. And the last pillar, the third one, is about entrepreneurial education, which is about what you see here, about education in a professional world, master school level, and also specific modules where we provide professionals specific skills. It could be in data science or embedded software, etc. But basically what this figure is showcasing is that we have 3 pillars where the European Union is investing in. And that has to do with the fact that we really have to speed up in order to be leading in the digital transformation in the world. So if you look to the different countries, the green ones are covered by our offices. So in 10 nodes we have our local offices with business development people, with innovation activities, with a lot of partners. And you can see some of them here. So in Italy, in South Europe, France, Spain, Nordic countries, etc. So we're also expanding into Eastern Europe, where we're also going to build up some offices in order to help the digitization into Europe. So what do we do actually? So we have a sort of innovation funnel where you can, at the left side, see that partners can join innovation projects, so open innovation projects, form a sort of consortium, and after a selection process, we invest in those innovation projects. At the end, it's the purpose to go to the market. And that means that we help them also going to the market. We have basically 5 working areas, from digital finance up to digital infrastructure. And today we are here with digital well-being. So health and well-being, it's the portfolio as we are showcasing today at Medica. The other activity in this innovation and entrepreneurial activity is about supporting scale-ups. And 2 of those scale-ups today are presenting. So I will give the floor in a couple of minutes to them about how they experience that and what their product and service is about. So to start with, I would like to invite IGNILIFE to give the presentation of what they are doing. Basically, it's occupational health. It's taking care of the well-being in corporate organizations, insurances, etc. But Fabrice will do that in a few minutes. The second presentation is about Checkpoint Cardio. They have a 24 hours, 7 days a week monitoring service for cardiac patients, which is very unique. This is unique in Europe. And they will tell about what our experience are so far. Then we have key elements, which is looking into early diagnostics, early detection of cognitive disorders through speech analysis, which is very revolutionary, so it's very innovative. And the fourth, but not last, is about occupational health by Prindit. And Prindit is also a startup and eager to provide you all the information you need. So after the presentations, we are ready to answer any questions. But you can also go to our booth here, just around the corner at the E56. So I would like to give the floor to Fabrice to talk about IgniLife.
Sorry about that, it's going to come. So, hi everybody, my name is Fabrice Paquin. I'm actually the CEO, co-founder of IgniLife. We are a French startup born in 2014, and our main activities, it's a preventive health coaching platform. So I'm just waiting for my slide to start. I think it's coming. Okay, so let's go. So back in 2014, when we created the company, we have two numbers in our mind. The first one is 75%, which represents the chronic disease account of the total health expenditures average in Europe. And the second number that is very interesting is 66%, which is the percentage of chronic disease that actually avoidable by adopting healthy lifestyles. So you can imagine there is something wrong in this in the system, in the sick care system. So in our vision, prevention is really a true game changer in the market to transform the health systems. But the prevention has to be something individual, something digital, a very good experience, very personalized and professional. So our mission is to empower and to motivate individuals to take care of their health and trying to do it for good. So our platform today, it's eligible to 10 million people all over Europe in different languages. It's a very data-driven platform. It's powered by machine learning. It's device agnostic. We are compatible with more than 1,000 devices of the market. And it's already GDPR compliant for the personal data in May 2018. So today our business model is to sell our platform mainly to health insurance companies. They really want to develop innovative services to improve loyalty, but also to reduce their risk. And we work also with medium and large corporations in order to increase productivity, but especially reducing absenteeism, managing better their risk, and lower their sinistrality. So some of our references in Europe today, we have 80%, I would say, of the digital strategy of a big corporate insurance company in France called Malakoff Médéric. They manage around 6 million lives today. And the platform is available in white label for them. And we have started actually our activities in 3 languages with Groupe Mutuel. It's Swiss insurance companies. They manage today 1.5 million lives and more or less 19,000 companies in the Swiss market. And we work with the IgniLife brand. So basically what you can do with IgniLife as a user. As a user first, the first experience you will have is to assess your health, is to know more about you. So you need to understand what's going on with you in order to act. The second point that you can do in IgniLife is to be educated. It's to understand. So it's to learn about your risk, to learn about what to do in a very personalized way. We're not going to give advice to everybody. The advice actually are segmented by risk and by people. And then the most important actually is to act. So we have more than 25 programs inside the application, and they cover all the preventive health science today. So we cover the health, the weight management, addiction to tobacco or alcohol, for example. We work on the balance your food, for example. We work on the sleep habits. We can exactly tell you what kind of examination or screening you need, and we follow your screening actually in order to empower you with your doctors. And we have also a program about physical activities, about your mental health. So for us, it's very important to work on the body and mind balance. So we also screen your anxiety level, your stress support, your social support, your life balance, and we have programs about your emotional health. Other points, everything you do inside the application, it's gamified, so you earn badges, you earn points, and you can actually spend your points with some rewards. So the health insurance companies generally have some benefits programs, so we integrate the benefits programs. So every step, very positive step you do inside the application can be rewarded with true life rewards linked to health well-being or your health activities. On the other point that is very important actually, because we think that our experience since 2014, if you want to change really your habits, the digital is a very good, I would say, Trojan horse, but it's not enough. If you want to motivate the people, you need to connect to real life professionals. So we have the ability actually to connect to nurses, psychologists, nutritionists, for example, where you can chat with the people or you can have some telephonic appointments and you know much better and you can be more empowered with, I would say, a personal relationship with true health professionals. So there is a big ability actually to connect services, an ecosystem of services that are contextualized and personalized to yourself inside the platform. So if we talk about our customers, on the customer side, what we can do, it's another application inside the application. First of all, what is very important for an insurance company or corporation is to be able actually to monitor very quickly and to launch very quickly a recruitment campaign with this population. So we automatize the recruitment process. We can, in maybe 3 clicks or 4 clicks, be able actually to send a launch campaign, a marketing campaign to millions of people. So it's a very simple for our customers actually to launch their campaign. We can integrate their services or integrate third-party services. We contextualize those services, personalize those services to the users. So thanks to API on web services, very easy for us in a single digital way to integrate those services and bring more value to our users. And the other point, which is very important, you have to give the way to monitor outcomes. So we have analytics dashboard so our customers can monitor 3 types of statistics. The first is about more the recruitment, the enrollment campaign, the retention inside the platform, which is a very important point. So in terms of engagement, they can monitor also the evolution of the population health risk, how my risks are evolving, do my BMI population is better, do people are stopping smoking or not. So it can actually calculate its own return on investment thanks to the dashboards. On the third type of statistics we give, it's more the habits inside the platform. What's the program are working, what is not working, what do people like, who doesn't like, so we can monitor and always improve what we are doing. So behind this kind of platform, there is an important point in digital health. It's the engagement of people actually. If you cannot engage your users, you can be sure that the process won't be efficient. So this is very something important. We always think about it. I think this is the grail that every digital health company should look for, is how to engage the population. So in our way, we are working on 4 pillars. The first one is the user experience. We are talking about digital application. So you need to be, it needs to be a very simple experience, interactive experience, a social. It needs to be also connected. So the pleasure to use and the simplicity to use an application. The second point is also the use of cognitive behavioral sciences. For example, when we evaluate our users, normally you are going to evaluate the health risk, but we do on a different way. We first work not on the true health risk of our users, but we work more on the perception they have regarding those health risks. So how do you feel about smoking? How do you feel about your weight? How do you feel about your stress management? They give their answers, and then we make a comparison with another assessment where we ask really the true question: are you a smoker, are you not? What is your BMI? So we calculate, and we can make the differences and know the cognitive distortion of the user and give a better recommendation. If you're a smoker and you are very comfortable with smoking, maybe the first recommendation won't be to say, well, stop smoking. It's maybe not ready for it. If you have, I would say, high BMI and you are okay with that, it means, okay, maybe you are okay also to change this. So it's important to know the cognitive perception of our users to actually give the better recommendation. The third point, for sure, it's personalization. You need really to give the right advice to the right person, as you need to give access to the right service to the right person, thanks to the integration by API of those services. So for example, for one of our customers, we have integrated a nurse platform, telephonic platform. They wanted actually to help the user with higher risk to have a kind of motivational interview, but they didn't want to give this motivational interview to everybody. It's a very expensive cost. So they say, make us an algorithm so we can make a sorting of the population. So if we have, I would say, the combination of those risks, then I want to directly let the user access to our service. So we make the algorithm. We create inside the digital application a connection with the nurse platform, and we exchange information via web services. To say the user is invited actually to say, well, you have access to these services. Do you want it? Yes, I want it. Do you want to send your information? Yes, it's okay. Then you have directly access to the scheduling of the nurses. You say, I want to be on Thursday at 4 p.m. And it's done, actually. The interview is made by telephone, and then after, all that has been said with the nurses and the user come back in a written form inside the application. So it's a very integrated service and personalized service. So just some outcomes that we already have. This is from our Swiss population. Very important point when we're talking about health population platforms, it's you need to have the assessments. So we have a very good, strong record on that. 92% of our users in their onboarding, they actually fill the health risk assessment. So you already have a very clear picture of your population since the beginning, one time they are connected. Also something good, but we would like it to be better. But 53% of our users declare that they've changed one or more lifestyle habits after 2 months using the application. And maybe also something that is important in terms of satisfaction. 67% we recommend in eLife to their relatives, families, or friends. And regarding health and personal data, and we were in the Swiss market, 75% say that they trust in eLife regarding the personal and health data. So for us, our mission is really to help people better enhance their life to millions. So guys, if you have some question about our company, please feel free to ask. Thank you.
Hello? It's okay? Hello everybody, my name is Ivailo and I'm coming from Bulgaria in order to present you advanced technology for telemonitoring. And I have the real pleasure and I'm really very obliged by the fact that I heard a lot of people in this today speaking on this stage, the other stage, about the politics, about how to put the patient in the middle, how the patient should be the point of care, and all the policies should go around the patient, and what we should do with the data. And I would like to take this game of words from my good friend from EIT, Giuseppe, who yesterday was speaking about the cure of the patients and the care of the patients, and actually about the balance between collecting the data and assessing the data, but also taking care of the patient. So actually, what I'm going to present now to you will give an example of what we do, because we believe that we have a perfect balance between following the patients, but also have real medical telecare of the patients. And because everybody is saying that we should put the patient in the middle of the care, I will demonstrate our system by showing you my personal biometric data. I'm not sure that it's visible enough, but I believe it's okay. So today, now in real time, you can see my data. This is my main biometrics of my body. As you see, my name. And you can see here that the system in real time is showing 6 and 3 channel ECG. And this is happening right now. So this is not a robot which is imitating my data. And you see that I'm very excited because my pulse is 157, which means that maybe I should go to my doctor and make a consultation. Or maybe somebody will be calling me from our medical center, because right now all these data are monitored in real time by real nurses and real cardiologists. So most probably somebody will be calling me and will be warning me that I have too big pulse. The system actually is first in the world who can combine these biometrics, ECG in real time, pulse, oxygen saturation, blood pressure without the sleeve, so it's non-invasive measurement of the blood pressure, respiration, and the temperature. But the temperature, I haven't put my temperature sensor, so this temperature actually is the temperature of the room we are now. And in order to see my blood pressure, I just need to put the pulse oximeter. We are taking the pulse from the ear, because this system is created for ambulatory patients. So this is patients which are going to work or studying or resting or going on vacation, and we are able to follow all their data in real time 24/7. So I would say that the technology Checkpoint Cardio, which I'm presenting to you now, is actually the first here, as far as I saw, the other similar technologies on Medica, which is a complete system when you have a real-time telemonitoring, you have the hardware, you have the software, and you have the server which this data are displayed, but also you have the medical care, which means that life specialists which are following this data in real time, they have alert system, automatic, and after that they have a physical reaction when they can call and give real advice in real time to the patient. The technology is very simple. We are collecting the data from the body, and we have a transmitter of data, which is something like a big smartphone with big battery, because it requires a lot of energy. It works with the simple GPRS signal, which means that the coverage, the ground coverage, is more than 99%. It means virtually that everyone can be covered everywhere. If he goes somewhere without the GSM coverage, the system is recording everything, and when he goes around again into the range of the coverage, all the data are restored automatically, and everything is recorded onto the server. Also, the system is it's interactive. On the device, we have a button here, and the patient, when he doesn't feel well or he wants to ask somebody of the doctors, he can call directly to the doctor from the same device and speak to the doctor, the cardiologist, who is actually monitoring the data in real time. Also, the system can position everybody. Right now, we can see that I'm in Düsseldorf, in the Messe, and the system has a live connection with 112. Which means that if we see some life-threatening signs, we can directly send the GPS coordinates to the emergency, and to send the coordinates together with diagnosis. And we have many cases when we have saved lives by sending the emergency car to a special address or special place when people have fainted, and together with the diagnosis, so they're collecting the patient and they know what is going on with the patient. The system is a doctor supportive system, the conclusion supportive system, because it creates a temporary conclusion. So all the findings which our doctors have found during the monitored period are uploaded immediately in real time. So imagine that you are with this device and your doctor would like to see what is going on with your health. He can go through a simple mobile phone into your file, personal file, if you are allowed that, of course, and he can see in real time what findings and what pathologies we have discovered during the monitored period. So this is Checkpoint Cardio system in real time. I would like to have couple of minutes of yours to demonstrate how it works and how it can be used. So we are a company which exists since 3 years, and since 3 years we are developing this system. This is our first appearance thanks to EIT Digital. First appearance to a big forum when we are showing that system for first time. Nevertheless, we are working with this system in a couple of countries, some of members of European Union, some neighborhood countries, neighborhood to Bulgaria. So actually we have these smart wearable devices, which can be 3-lead and 12-lead devices. We have we are bringing them to real life of people, and we observe these people 24/7, and we provide very affordable, really affordable medical service. Why we created this system 3 years ago? We started working on that because you know that Europeans and many other nations are dying from heart. 50%, even more than 50% of sudden deaths are coming from cardiovascular diseases, which means about 17 million people every year. And you should note that each one of these deaths is preventable, each one, because there is no cardiovascular disease which cannot be cured. It's a matter just of diagnostics in real time and on time. So what we see, how we see our model and our development is that we would like to give the opportunity of the patients to be connected every time, all the places, with a dedicated medical team, and they should be monitored 24/7. And this service should be affordable. It should not be a luxury service. It should be affordable for everybody. So actually, we would like to integrate the system in an existing healthcare system, from one hand, and from the other hand, to remove the offline devices which now are used for patient diagnostics, like Holters. As you saw, we are measuring at the same time the ECG and the blood pressure, which means that we are combining 2 offline Holters in one device, very smart, very small, very cheap, and online, which cannot be provided by the Holters. So we have 3 types of the devices. We have a 24/7 diagnostic center, and we have developed and patented all the parts of the system, including the hardware, the software, all the algorithms, and all the data sets. So, as I already said, we have the hardware, we have the software, we have a social impact with this technology. So the main result of this system is that we reduced significantly the risk if we are doing this screening and we are doing these diagnostics on time. So what we are offering to the market is that we can bring this healthcare system to every home, but also to provide these services on very affordable price. So today, the way ambulatory care of the patients is done by different medical organizations is very highly ineffective. And we, on the other hand, are proposing something which is not a luxury but very affordable. So it should lead to significant social impact, such as life-saving, reducing different costs for the health system, reducing the risk, etc. So our services which we are offering is co-response. I already showed you on this device. We can call to the device and the patient can call from the device, even they don't need to have their smartphone. So we are producing diagnosis in real time, and and this is used today. We are working on several projects with pharmaceutical companies. We can correct the medication plan. because when somebody is taking one medicine, we can see immediately how the heart continues working. So it's very effective for medication plan. With our system and with our medical team. So this is one of the rooms when we are making this 24/7 monitoring. It's a simple organization. You have teams of 1 doctor and 4 nurses, and they are a special organization of this team. So we have 3 levels of filtering of information, automatic filtering, nurses, and after that the doctor. And all together they are making all the services I just demonstrated to you. And there are alert system which is sending the pathologies and patients at high risk in different room when other doctors are observing them. So our key customers with whom we are already working in several countries, of course, those are hospitals, and this system is used for intra-hospital monitoring, but also for after-hospital treatment when they are suffering from some heart surgery or some intervention invasive procedures. And we work in 19 Bulgarian hospitals and hospitals in 4 different European countries. Care homes, old people, and hospices. So we work with healthcare professionals such as GPs, and also we are working already with private patients. So there are similar systems in a couple of countries, but not too many. So as a first and the most distributed competitor of us, this is the offline devices, so offline halters. All the healthcare professionals are used to them, but now they are, when they start using our system, they are getting used to our system very quickly because it's online, it's easy to access, and they have the support from our medical team. So actually the data assessment is much easier and quicker and precise. And there are 3 companies, 2 of them in US and 1 is in Israel. But actually, the differentiation between these companies and Checkpoint Cardio is that we produce everything by ourselves, everything is patented and protected, and we are one of the main movers on the EU market because all these systems are working mainly out of European Union. So this is a fast-growing company. For 3 years, in the end of 2017, we're expecting a revenue of about 400,000 euro. And in our plans, it should be multiplied by 5 until the end of 2018. This is a branch of some of the hospitals we are working with, or we are in test periods. As you see, there are companies from the Middle East, from European countries, also from Turkey, from Greece, neighborhood countries to Bulgaria. And one very interesting clinical trial based on exhibition of monitoring of more than 4,000 patients. From 4,000 patients, when we have monitored them for, in average, 5.6 days, we have discovered 71% rhythm disorders. 29% ischemic illness or ischemia. And in 78% we have discovered new status, new clinical condition. Actually, these numbers, and as a result, in 82% of the cases, we have changed the therapy, and this is based on pretty big research on 4,000 patients. Those actually numbers are showing why 50% of the sudden deaths, even more than 50% of sudden deaths, are coming from cardiovascular diseases. It proves that if the patients are constantly monitored, they are cured and many of the pathologies are caught on time, and most probably we have saved many lives out of these 4,200 patients. So the idea of developing of our network is easy. we are here to meet and to start negotiating with potential partners in different European countries in order that we transfer some rights and some technologies to them. We start creating local services network, and we start working with doctors, with hospitals, and with research organizations, and also we organize and control the patient flow. So actually, as many people said on this stage and the other stage, this technology and technologies like this are disrupting the healthcare because it brings the real healthcare out of the hospitals, out of the offices of the doctors. It can be everywhere, and every doctor in the world through our system can monitor and can make diagnostics to every patient in the world, because GPRS system is the easiest and the most accessible network in the world. So we want to develop research. We want to sell to general practitioners and hospitals services, online services 24/7. We would like to make clinical trials, and now we are developing artificial intelligence, which will give us opportunity to be first in the world to make assessment of data in real time, not like post-processing, but when these data are going in real time, to be able to find the pathologies and to calculate the level of risk. So finally, the end point is that we would like to have a huge network with different organizations as partners, and to develop different scientific tools to create, to save as many lives as possible, and also to create a decision support system for health professionals. So as we see the future together with the help of EIT, we are looking for locate partners, establish telemedical networks, and to deploy this system in different telemedical centers in Europe, in European Union. And finally, to create a big patient portal when the doctors and patient can log on, and every doctor can make every patient data assessment and make diagnostics in real time. So this service to be accessible to everybody, and every doctor which would like to join this network to be able to make data assessment, to make online diagnostics from distantly, and to make money out of it. So this is our team, medical team, marketing and sales team, and R&D team. Those are people from the big data analysis and from hardware and software development. So we are a pretty young company. We are demonstrating this system since this year, and we already got, we were acknowledged from TNW in Amsterdam in May as the most promising, one of the 7 most promising startups among 12,000 companies. And we already got one local award for the best startup in Bulgaria. Those are the contacts with me and my colleague Boris, who is sitting on the last row. So thank you very much, and if you have questions, I'm here, and Boris is here to answer. If we don't have time, maybe we can discuss that later. It depends on the organizers. Thank you very much.
Yeah. Good. So, good afternoon, everybody. My name is Johannes Tröger, and I'm one of the founder of Key Elements. And what we do is measuring cognitive health through speech. So the title of this little program point is delivering impactful digital health and well-being solutions. So impactful. What does that actually? What does it actually mean? I think, or we think, we can create impact where the biggest challenge is. So we have been listening to cardiovascular diseases a little bit, in the past there was were different big health challenges, but I gonna focus on some of the underdogs of our big health challenges. And this is neurodegenerative diseases. It's basically, let's focus on Alzheimer's, which is actually one of the biggest challenges of the 21st century for our society and especially for healthcare. I'm born in the 1980s, so I'm one of the baby boomer generation. When we age, the chance to have Alzheimer's, when we rightfully hope to become 80 years or older, chance of getting Alzheimer's is 50%. So it's gonna be either me or some person I love who has Alzheimer's, and I have to either take care of myself or of somebody else. So it's gonna affect pretty much almost everybody. What is a bit frightening right now is that in Europe, only 50% of all cases are actually diagnosed. So Alzheimer's or other dementias. Which is bad, because detecting dementia early and efficient is the key to effective treatment. May that only be for the sake of treatment or just for the sake of smoothing the impact or preparing the environment for the impact when the disease actually hits at its peak. Because when people have full-blown Alzheimer's or dementia or other neurocognitive disorders, they start behaving very dangerously, only for themselves, but also for their surrounding. So confusing milk and cleaning liquids might be a problem, but therefore you have to know to put measures in place before. So detecting, how is that typically done? You can do two things. This is either functional assessment or anatomic structural assessment. The right side you might all know is this brain imaging test. A lot of you already have been in MRI scans, I guess. Genetic tests, spinal fluid tests, PET scans, and so on and so on. What they all have in common is they are either not scalable because you have to go to the hospital, or they're depending on very expensive machinery. For the example, the MRI scan is not a machine I'm going to have in my garage in the next 20 years, because it's a very expensive machine. You only find it in hospitals, but people don't live necessarily near to hospitals, so that's a problem. Or they are invasive. For example, spinal fluid tests, it comes with like weeks or a couple of days of real impact on your health. Actually, you don't feel well, you have to lie in bed, and so on and so on. But the good thing is the functional assessment, the comprehensive neurocognitive assessment. This is very good. This is very good scalable, because it's just speech basically. So these are tests which are done with your neuropsychologist or your geriatrician, and these are all based on speech. These are tests which assess how your brain is actually working, not just the anatomy of the brain or the biology behind, but how is it actually working. So how does it look? The traditional setup is face-to-face with an expert. So you have somebody like a neurologist, which is sitting on the one side of the table, and you as a patient sit on the other side of the table. And the neurologist is going to ask you questions or give you tasks. Like one task could be maybe, I give you 60 seconds of time and you produce as many animals as you can. And then you as a patient would go like cat, dog, bobcat, hamster, guinea pig, and so on and so on and so on. And if you have problems in such a task, this is a good indicator that your brain or a certain function of your brain does not work, which is also a very good indicator for developing an Alzheimer's disease. Well, the problem is there's a lot of tests, and this is not very easy figuring out, because there's different diseases which tend to behave like Alzheimer's. So you have to separate very carefully. Experts have to do that. And there might be even, very important, there might be other states like depression or conditions like substance abuse, which might behave like a neurocognitive disorder, like might behave like an Alzheimer's disease, but they're actually not. It's just a depression. Well, so during these tests, the professionals, they have to do a lot of things. They have to concentrate on the task performance level. So they have to look, well, is the patient actually doing the task right or not? What is a hit? What is a miss? They have to look on meta-task performance. So is the patient working well on the task? Does he apply strategies how to solve the task? Which is a good indicator for a good working executive function as a frontal lobe of your brain, for example, which is also impaired in Alzheimer's or in frontotemporal lobar degeneration, a lot of diseases. Then they also have to focus on linguistic levels, like paraphrasing. If the patient, for example, would say ekaphant instead of elephant, well, that's a problem because it's an indicator for aphasia, for example, and you want to detect that if you're a speech pathologist. Semantic level is also very important. Choice of words. Sometimes people confuse words, which is a good indicator for semantic dementia, for example, which is also a very particular disorder. And paralinguistics, of course. Prosody is very important because it's an indicator for mood, or it's an indicator for apathy, the lack of emotion, things like that, or that just being slow. This is all very important. And then on top of that, there comes that the specialist does not only have to focus on all these 5 things I just showed you, but it also has to conduct the test, which is up to date mainly paper pencil based. So if you go to a neurologist somewhere in some hospital, they're going to pull out a piece of paper and a pencil and they're going to do a test with you. So they have to write down all the answers and so on and so on. Afterwards they have to analyze it and then they have to visualize it somehow and generate a report out of it. So that's what we would call the barrier of unnecessary manual workload, because that prevents the expert from looking at the patient or interacting with the patient, which is actually the most important to do a good diagnosis or effective diagnosis. So that's why we created this, our first product, which is, we call it Delta for now, which is actually doing exactly that. It's just removing the barrier of unnecessary workload through automatic speech analysis. That's where the speech analysis comes into the picture now. So what we do is we have an iOS app, so you can run it on your tablet or on your iPhone, wherever, and it records speech. It does some automatic speech recognition. It divides it into different features. It combines them through machine learning to clinically relevant features, which is also very important because we know what experts are looking for, so we want to feed those things they are looking for. We don't want to generate some machine learning wizardry and say, well, there is this patient has Alzheimer or not, because that does not help the clinician. We do not want to replace the clinician. We want to help the clinician to do more effective work, because we think clinicians, they do what they do and they do it best. And we want to support them through, for example, interactive visualizations to show them our results, show them more results, and show objective what has not been objective before, because clinicians, they have to focus on so much things during testing and not on the patient. So here again, we build on the DSM-5 approach, which maps everybody's cognitive function on 6 neurocognitive domains. Learning and memory is one of them, language, executive functions, complex attention, and so on, psychomotor functions. And we typically cut here. That's where our professional tool cuts. So we make neurocognitive domain mapping just to show a good overview of how the patient actually looks, like neurocognitively, how is the brain functioning right now. And then we cut there, and we don't do the machine learning and diagnosis classification, which we could also do in a screening application, for telemedicine, for example. And then we make visualization for everybody, but only to the extent they really need it. So for example, general practitioners, they just need a very quick overview of how the patient is doing. So the left side, for example, has this mapped neurocognitive domains and how this patient is doing on a simple radar chart. And you can see, well, is the patient doing well or not so well? And if not, they can send them forward to a neurologist who really goes into depth. Yeah? Or you can look at some tests, like the semantic verbal fluency I was referring to before, the 60 seconds I ask you to produce as many animals as you want, for example. We have some test results, which are also shown in green or in some colors, which actually indicate how good you're doing compared to a standard population. Yeah? Or you can also go into all depth and analyze in depth the whole task, which is very interesting if you wanna do testing for clinical studies or clinical trials, or pharmaceutical studies. But it's kind of the level of expertise grows from the left to the right. So you have general practitioner, you have some normal self-employed geriatrician, and here you have really experts working in research clinics. Gonna show a short video of how this app actually behaves in the real world. If not, you can also visit our booth, which is in this direction, only just around the corner, and you can also see the app in live. So actually we have that app, you can open it, and it has, you see on the left side, it has full patient management. You can have new patients and edit all patients. Then it comes with an overview. You can select from a couple of tests which are well known for all experts, neuropsychologists, neurologists. They know those tests, and they do it on a regular basis typically. It comes with instructions. You can read out the instruction. You can select languages. And as soon as some of those tests is done, it provides you those overview. And if you go into detail, it also shows you the very detailed analysis of a performance. This, for example, is a French performance. This lady was producing 39 animals, a couple of repetitions inside. It's a pretty good performance for somebody who is in the age of developing Alzheimer's. So this patient has definitely no Alzheimer's. Then you can, of course, edit this, and it gets sent back to the server to improve our analysis on the long term. So Delta basically is built on a very strong medical collaboration, because we believe that if we collaborate with those who are going to apply it in real clinical practice, then the solution is going to be the best. Right now we work together with in Nice with Association Innovation Alzheimer, which is the memory clinic in Nice. We work together with in Saarbrücken. That's also where the company is based. Key Elements is based in Saarbrücken, with a clinic, and with 2 clinics actually, and in Switzerland with the University Clinic of Bern. So and we're looking forward to integrating new languages. Right now it's French and German, and we also have English. So what's next? This is basically all our use cases we have. On the left corner, this is the clinical use case. So if you're a hospital, well, we can provide you with the app. It records automatically, analyzes automatically for you, and you get feedback. If you're a care service provider, for example, we can realize some telemedical health scenarios, and it will get sent back through our API to the analysis server, and then some medical expert could look at it and make some use of that analysis. Or we can also think about third-party providers. So if you already have a medical product in place, you want to just use our API because we do the speech analysis for you, send the speech recording in, and you get out a very detailed analysis of that. Well, so if you want to talk about these opportunities, then we are over there. Happy to answer your questions, show you a demo. And I thank you for your attention.
Oh, can you hear me? Yep. Hello, I'm the last presenter today. My name is Stefan Cedergren, and I'm the innovation activity leader for Wellbeing at Work, that is part of EIT Digital Wellbeing. And I'm a research leader at RISE, and RISE stands for Research Institutes of Sweden. And we have a project together with Professor Roberto Verganti at Politecnico di Milano. And the result of our work has resulted in a startup called Prindit. Prindit stands for Predictive Indicators. And IT represents that we want to make things more predictable in organizations. And our goal is to cultivate both efficient and innovative organizations that are, of course, also has high well-being. To give you an example, I think you all recognize the Tesla car, but do you know that there are more than 1,000 sensors in a Tesla? And all these sensors are there to collecting data. Data that is very central to controlling the performance of the car, but it is also very central for monitoring the health of the car. and to indicate when we need to do maintenance and so on, to make sure that the car works in a proper way. Imagine that you were a manager in an organization and had access to the same amount of data. Because today in organizations we are very good at measuring things that helps us control the organization. But we're not very good at having data that helps us monitor the health and the well-being and cultivate conditions to be innovative and efficient. As a result, I think many of you may have seen these numbers. Gallup claimed that only 13% of all employees worldwide are engaged at work. And that is a really terrible number, I think. But the key in order to have more engaged employees at work is to really work on leadership. But the Swedish Labor Environment Authority have found that the leadership is often very poor, and that there is a high cost of poor leadership in organizations today. And the number they show is that 10,000 euros per employee and year is the cost of poor leadership in organizations. So there is a clear need to improve this situation. So with Prindit, we see every employee in an organization as a possible sensor, because the employees in the organization know how they perceive their current situation. And at the same time is research quite clear of what is important to have a healthy, high-performing organization. And one of the frameworks that we have built on says that if you want to have a sustainably high-performing organization, you need to have a clear demand. What is demanded of everyone in the organization, that everyone knows this. But not only the demand, you should also be in control of your own situation. Are you able to make the decisions you need to make in order to deliver on the demands? And are the demands clear enough? And the third part is to have support in the organization, that the social support, both from your colleagues but also from managers in the organization. So if you have high support and high control, you're also able to have higher demands without having an unhealthy situation. So we have, based on the concept of having every employee as a sensor, we have developed a methodology consisting of 3 steps. The first step is to be able to identify the current situation in the organization. And I will show you how we do that in the next slide, but this gives us access to data that we can analyze and make conclusions on, and then we can feed this information back to the information, both to the employee, but also to managers on a team level and the organization as an overview, which makes it possible to act and make improvements in order to make sure that we have the right conditions in the organizations to perform. So the identify step typically looks like this. We have like typically 10 statements, like I'm able to finish my tasks on time, and then I rate how I perceive the current situation on a scale like this. And our measurement shows that you can do this in less than 1 minute, which makes it possible to do it once a week in organization. And when you're done, you press submit in the end, and then you get a direct feedback on your results. So this is a typical dashboard on how it can look on your own result as an individual. But it also looks the same when you're a manager on a team level. And we have also a very different way of visualizing the results. So typically up in the left corner in the spider chart, we show the difference from this week compared to last week, so you could easily see changes. We also look at correlations to see how different factors relate to each other, and so on. And also showing the progress over different weeks. This is a typical chart of how it could look like on a team level, where we not only show the mean level, but also the standard deviation, showing you if everyone in your department or team perceive that you have a similar situation or not. And as you can see, the results varies quite a lot over time. So it's very important to create awareness of the current situation. But we not only give direct data feedback, we also have some guidelines for how you can improve. So for every question or every factor we test for, we also have first a description of why this is important. We show you your current level and sort of give you a quick interpretation of that result. And then we also have some suggestions on what you can do in order to improve. And typically we also have links to TED videos that have a lot of great information to give you inspirations of what you can do if you want to change or have any new ideas for how to improve. And typically how it works in organizations is that you as an individual answer this very short questionnaire and are able to reflect and make improvements or changes if needed on your own situation. But then the data is also on your department level. You can see the result there, and together in like weekly meetings, or if you have the meetings that you have, you can also look at the results together and agree if you want to make any changes. And that's also possible to do if you work on a project team. And then we also show the result on a overview on an organization level in order to get an overview of the entire organization. And some of the findings we see is that since our questions and the things that we focus on is based on what research says is important, and even though we may know of these factors from before, it creates an awareness. And you can see what happened this week compared to last week, and why was this week so much better. So it creates a good awareness. And it also enables systematic improvements. Because when you have access to data, you can also see if it has a positive effect or not when you try to change things. And it also complements existing measurements in a very good way, because we don't measure these things currently today. And we also see quite big improvements. We have seen improvements of up to 30% in an organization within 4 months, but when they start working with this. And here is a quote from one of the managers at ABB that we worked with. He said that it was especially useful to change the culture in his team to become more open and talk about these factors. And it also helps them to detect deviations faster and making it easier to work more proactively. Currently we have more than 8,000 users in our system, and we are working with 16 customers at the moment, including large companies like ABB and Bombardier. And we have users in more than 10 countries. This was my last slide, so please come talk to me if you want to know more. Thank you.